We're going to start, and obviously we're like the rest of New York now, sitting at home and being nice and close and cozy to each other. But we do still practice social distancing when we go outside. And today's presentation, we really want to talk about COVID-19. What do we know right now? How do we prevent it? How we treat it? And how do we recover from it uneventfully? That's our goal. Want to remind you that all the information that we're presenting today is current on today's date. As you probably observed in the last 2 weeks, information is keeping evolving. We're learning more and more about the virus. We're getting the experience of other countries. We're learning something on our own. And so what we're presenting today is what we know right now. It might change tomorrow, so please take the facts that we're sharing with you today and confirm it with us tomorrow, because it might change. And so we're going to take off right now. So,
right.
Marc?
So first thing is to understand that we're going to do a quick presentation. It may last about 25 minutes or so. I hope you'll learn a lot about COVID-19. And then afterwards, we'll do a question and answer session. And we're going to ask everyone to put any questions that you may have into the chat box, write them in, and then we'll go through them one by one and answer all of your pertinent questions at the end of the presentation. So thank you so much. And let me just introduce Dr. Klimenko, who's just been kind to start off. And if you don't know who she is, Dr. Elena Klimenko, sitting to my left, has been a physician for how long, Dr. Klimenko? 26 years?
Yes.
26 years. And how long have you been involved in functional medicine?
Since 2007.
Since
so it's 13 years.
So you're very involved in integrative medicine, and I know that you're an acupuncturist, a homeopath, an herbalist, a nutritionist, just about everything that can be, right?
And internist, yes.
Do it all. Okay.
And let me introduce Marc. For those who don't know who Marc is a licensed acupuncturist with a vast amount of knowledge in functional medicine. As you probably know, we work together. And Marc, how long have you been practicing acupuncture now?
Over 25 years in practice, specializing in treatment and care of eyes, pain management, autoimmune diseases, nutrition, etc.
Yeah, so now we're all kind of specializing in infectious disease. In the last 2 to 3 weeks, as we were quarantined, we've been avidly learning about COVID-19, and that's what we want to share with you today. So you are up to date and you know most updated information.
Great. So if you're ready, let's take off. Here we go. A lot of information to unpack in the next few minutes. So first of all, here's the map as of this morning. And you can see all of the cases. They are spread all around, all those little dots all around the country. Still the epicenter here in New York City, where we are speaking from. And I think what's most important to understand is that this COVID virus, as we see on the news, is really starting to lift off exponentially. And as you can see, the epicenters are going to soon begin spreading. So it starts in very crowded, condensed urban areas. And then soon enough, it'll be everywhere. Every county, every town will have COVID.
If I understand it correctly, that's kind of atypical for upper respiratory tract virus infections to spread this way, because it's an airborne infection, right? So people spreading it as they communicate with each other. And so it's a kind of a normal course of events. We will see the climb number of confirmed cases and unfortunately also deaths. And we'll get into the depth of it, why it is.
Right, so right now we see that as of this morning, 39,140 cases in New York State confirmed. And then here you can see in New York City specifically, and if basically there's a quick formula, it's called fatality rate, and that is we take the number of deaths and we divide that by the total number of cases. So we come out with latest statistics of a 1.57 fatality rate, but you can see in New York City alone, as of this morning, we had over 20,000 cases. So it's really huge. It's climbing exponentially at this point. So one of the most important things I want everyone to understand is that as we have functional medicine and integrative medicine backgrounds, that really to combat this disorder, we need sort of a comprehensive or integrative approach. And here you can see in the slide, this goes back to Wuhan, China, Well, of course, they practice a lot of Chinese medicine, so-called traditional Chinese medicine. This gentleman is actually administering acupuncture to a patient in the hospital. So they already had integrative medicine happening. And so in order to combat a virus, we're going to need everything we have. So that's pharmaceuticals, that's supplements, it's quarantine, everything. And at some point, maybe acupuncture might be rewarded to the patient load, maybe not in its acute phases. So here we see the viral mortality rates compared to other viruses. So Ebola, very high mortality rate, over 50%, MERS, 34%, so on. If you look down at the bottom, you see the seasonal flu, it's only 0.1%. And even at 0.1%, you have a lot of deaths in the country. However, if you look at COVID-19, you can see it's currently at 1.5% mortality rate. And so that's basically 15 times a capacity of the flu. So 15 times a number of cases.
This is the numbers for America right now, right? Because
correct.
Other countries
this is for
have
America.
different numbers.
Right, this is the current, this could change, but this is current in the USA. And then here we see mortality by age. So we hear a lot about different age categories being high risk. And so you can see on the chart above, you know, once people are at 70, they're at a significantly high risk. In the 80 plus category is where you see the most significant risk. But what I want everyone to really understand is that risk are also at lower age groups. So even at 10 to 19, 20 years old, people can die. So we have to take this seriously all through the population.
My understanding, and from the latest data that I've learned yesterday, nobody from 0 to 14 years of age is getting sick. No one. So, and we can talk about this, why is it? And it's hypothetically, of course, but basically children are spared. With that said, we don't know if they're transmitting. Most likely they are. They are asymptomatic and they don't get a severe disease, but they're still transmitting it to other people. But from this graph, what I understand is our elderly are those who need the most of the attention, and they need the most of protection in this in this virus.
Right. So according to the statistics we've seen, of course, experiencing this coming through China, et cetera, this would be the group 70, 80 plus that would be at highest risk.
And so how to not to get the COVID-19 virus. Now, we actually know very clearly, and it's actually very rewarding and very calming for all of us to know how we can get this infection. And it goes back to the basics, okay? We get it through the prolonged contact with someone who is actively sick or someone who is about to get sick. Majority of the cases are spreading between family and friends. And that's why we need to be socially distanced from everyone but our family. So we can sit close to each other because we're in the same household, but when we go outside, we want to be in the distance from each other. So number one reason we get sick is through the dirty hands. So I want everybody to become OCD, obsessive compulsive, about the washing the hands. It's okay to touch their doorknob in your building or in your house or in the store. It's okay to touch their buttons in your elevator, but you have to wash your hands after that. The second most important factor is that the virus will not penetrate from your hands into your blood. No, no, no. It only gonna get into your body if you touch your face, if you touch your eyes, nose, or mouth, or face with a dirty hand. So rule number one, clean your hands, wash them, sanitize them. And number two, do not touch your hands. So that's where using mask is extremely important because it teaches you not to touch your face. So therefore, when you go outside, it's worth to have a mask on just for the sake of preventing you from touching your face.
So that would work also for food, right? I mean, if someone touched the virus and they handled food, put it in their mouth.
Right.
Right.
So another very important factor is do not touch people who are sick, or don't contact people who are sick, don't communicate. So that's where the social distancing becomes really, really important. And if someone's sick at home, avoid sustainable contact with the family when they're sick. And we'll go over that later. Washing hands, everybody knows that. You wash your hands as many times as possible. You cover your cough, you sneeze, you use your elbow or tissue, you avoid you touching your eyes. And also when you come outside from being out and about, I encourage everybody to wash your nostrils with soap as well, because that is where their virus can come in most likely. So washing your hands and then washing your nostril with soap and then washing it again. Use nasal spray when you come back from outside. Use just a normal saline nasal spray. And if you do have a homeopathic silver, like our Gentle 23, spray it after you come back from outside.
Okay, so let's just talk for a second about the science of hand washing and why it's so important. So I want everyone to understand that the virus itself is coated. And you can see a picture here on the lower right-hand corner of the virus. It's actually coated with a sort of a fatty substance. And so when we use soap, soap has surfactants built into it. And surfactants actually break down the fatty material. And so when a virus particle clings to the skin, perhaps on the hand, we use surfactant, it actually gets rid of it. And furthermore, the other things that surfactants can do to the COVID-19 virus, they can actually split open the envelope. COVID-19 is an envelope virus. What that means, it has a coating over it, a protein coating. And when we use soap, we can actually crack that envelope, and that destroys the virus. So that's how important washing the hands with soap is.
So do you really need the antibacterial soap for that to happen, or just a regular soap works as well?
Yeah, great question. You really don't need the antibacterial, just plain soap. Washing hands 20, 30 seconds, getting into all the crooks and all the crooks and corners into the hands, the fingernails.
Under the nails.
Under the nails, do a really good job, but it said 20, 30 seconds will do the job.
How long does the virus last on surface? We're going to talk about that. So here's the picture that kind of clarifies that, right, Mark?
Right. So soap, 20, 30 seconds. Get everywhere, wash your hands thoroughly, and do it throughout the day. And that is actually one of our biggest defenses that we can continue to utilize. So when we talk about materials that COVID-19 can cling on to, here's a list of basically about how long some of these things can last. And I apologize, the slide is cut off a little bit, but hands, less than 5 minutes, it will last on. Non-woven fabrics, less than 8 hours. Wood material, less than 48 hours. And basically, everything else is, a matter of hours. 24 hours on cardboard. So if you do get UPS or FedEx boxes delivered, be careful. It's a good idea to use latex gloves to open it up. I know you'll identify another way to do that shortly. But basically, when we talk about plastics and stainless steels, it can last 1 to 3 days on those materials.
Right, and we just want to clarify that this is most likely your home is a shelter. You don't have the virus floating around in your home. But if you have exposure from outside, like their UPS or USPS, your post service delivers the carton box, I personally like to quarantine that box for 24 hours. So I know that it's actually safe to open and bring it into my apartment.
How about groceries? Grocery delivery?
That's a good point. This is what I want to teach everyone today, how to maintain your shelter in place. Your home is the sacred place that's supposed to be clean and that we feel comfortable. Your home is your castle, right? But what if there's outside deliveries? What if you have grocery delivery? What if you brought groceries from outside? How can you quarantine it? How can you distribute all those things safely for your own household? So here's a small tip that I learned from my teachers. When you come home with the groceries, lay the towel on the floor. Put all your groceries bags on that towel. Then prepare an antiseptic or cleaning solution. And it's basically a bleach, very weak bleach solution mixed in the water. So here's a solution that I wrote for you. There's a mixture of 2.5 cups of water and 1 teaspoon of bleach. This will create a very good antiseptic solution, so you can use the cloth and wipe off everything that you brought. Fruit and vegetables can be easily washed and the virus will be discarded. But if you want to wipe it with a cloth dipped into there or soaked in that bleach solution, you can do that. After you clean your groceries or quarantine them, then fold everything up, throw away from your household all the bags and wrapping materials, and then put their towel to be washed. So this way you're not contaminating your household. And I already said about the boxes to quarantine their deliveries for 24 hours, then they become safe to open.
Great, that's so important. So tell us a little bit about social distancing.
Practicing the social distancing, it works. We need and I'm sure a majority of you are already doing it. Even if you're staying home, if you're well, stay home. It doesn't mean that you cannot go outside. I want you to go outside and take some walks. Remember, washing hands, not touching your face, staying away from people who are not from your household, at least 6 feet apart. But you need to go outside and you need to get some fresh air and maybe some exercise. Just keep practicing that social distancing. And of course, we want to prevent and protect the most vulnerable population of people. It's our elderly. Avoid exposure to elderly people and people with underlying health conditions, those who we need to protect the most. Try not to visit your elderly parents or elderly friends. Offer to help them with delivery groceries and other goods, but ask the delivery man to leave the groceries outside of the door for them so they can take it and use it. So avoiding the direct contact with elderly. In my family, so our parents are both elderly. Marc's parents live in Cape Cod, so they are in total isolation. My parents live in Brooklyn. And for those of you who know that my dad has been really heavily involved in taking care of our son, Zachary. Now he is at home. He's not coming to see us, but we talk on the phone as much as possible. We do not isolate them. We just prevent exposing them to viruses.
Okay, so we've come up with basically a 4-step plan. And the first part of the plan is prevention. Now, prevention, of course, is key. That's all we want to really get across, because we don't want any of you or your loved ones to come down with COVID-19, if possible. So it's really important to keep a very strong and robust immune system. We call that the shield. And Dr. Klimenko is going to go into some of the details in just a couple of moments about how you can do that. And then I'm going to explain in a moment about what happens if you do get sick, and that would be the virus coming into the respiratory system and actually getting into the cells in the lung tissue. That would be infection. And then we'll go through a couple of steps there, and then basically recovery. So we have a 4-step plan, and the plan, as I said, is an integrative plan. So in integration, we're talking about supplements, we're talking about some sort of isolation, we may be talking about pharmaceuticals as necessary as well.
Okay, so in terms of prevention, can I go back? Yeah. So when we talk about prevention, we definitely want to understand that it's not about the virus, it's about the host. And we know this from the basic biology and basic science of an infectious science. There are people who were, the leaders in infectious science, like L.A., who spent his life learning about microbes. He, even back in the beginning of last century, he concluded that it is often seen that in households where all members are exposed to the same microbe or danger, or again in school or troops where everyone lives the same life, the disease does not strike everyone indifferently. So we know that it's about the host. How can we strengthen the host? The same thing that Louis Pasteur, who spent his life thinking and chasing the microbes and germs and thinking that the microbes are everything, host means nothing. Before he died, he actually confessed that terrain, meaning the host, is everything and the germs is nothing. So how are we going to protect ourselves? How are we going to create that immune shield that if we are exposed to the virus, will have uneventful course of their COVID-19? Because the truth is, we're all going to get exposed to it earlier or later. And we'll talk about why we want it to be later. But if we are exposed, what are the key factors to keep the immune shield strong? And it's food, your sleep, your stress, your possibly your supplementation, and the social distancing. So when we talk about healthy food, what do we mean by that? Many of you are already pretty well versed in it, but eating plenty of organic vegetables and fruit, more vegetables than fruit in the ratio of 4:1. Why? Because fruit is still sugars, and we're trying to minimize sugars. Sugars are pro-inflammatory in any food form and shape. You want to consume clean animal proteins, grass-fed beef, lamb, organic chicken, organic poultry, maybe organic fish, if you absolutely need to. For this period of time, try to limit your sugar. Avoid any processed food. Why? Because those food usually have additives that can weaken your immune system and not serve you well. Hydration, 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 extremely important. Drink clean water. How much water you want to drink? You want to drink at least half of your weight in ounces. This is in the regular, good, healthy time. You're not sick yet. You're just trying to prevent illness. Avoid excessive amount of alcohol. Oh boy, all of us probably know that staying at home, being stressed, looking at this computer and reading all the scary stories about COVID makes you feel like, oh, I want that glass of wine, right? Or I want that drink tonight. Please try to find replacement for the stress management, and not with alcohol, but with other means. Getting a good quality of sleep. Do you know that when we sleep, we release the hormone called melatonin? Many of you probably have heard about it, and you know that you can take external melatonin. What we know now that melatonin that is produced during the deep sleep stimulate your innate immune system. So people who do not sleep well or don't get enough of adequate amount of sleep will not have a strong immune system. So please get your sleep. It's extremely important, as much as taking your vitamin D or any other supplement. Try to be in bed before 11 p.m. Limit your screen time after 8 p.m. Why? Because the blue light that emitted by your screen device will block that famous melatonin that I was just telling you about. So use the blue light blocking glasses. You can get them online. Please avoid any stimulants before bedtime. That's related to coffee, tea, sugars, anything that you know stimulates you. Try to get 7 to 8 hours of uninterrupted sleep per night. If you're having a difficult time sleeping, please use your Epsom salt bath or use aromatherapy bath. Add a couple of drops of lavender oil into your bath. Meditate. If you didn't meditate yet, this is a great time to meditate. There's plenty of apps out there that can help you to get meditation for free. And please keep your working routine as much as possible. It's easier to kind of sleep off the routine because you're at home, you're not working, you're not doing anything. Try to force yourself to wake up on time, go for a walk in the fresh air, take your shower, change from your pajamas, and stay on top of things that you usually do. It will help you to keep your routine and keep your life going instead of kind of sinking into this unknownty.
So sleep is tied very importantly to the immune system. And I think we have a lot of studies that indicate and show that the less sleep you get, that cortisol goes up, and so the body's more stressed out, right?
Yes, yes.
And that drops the immune
capability. And we're going to talk about this as a next step of the stress, how stress affects our body. Of course, cortisol will stir up our immune system and can actually fail to answer to the invaders on time. Again, how do we control the stress? From my experience, I notice that if I am on the phone checking all the posts and all the messages that I'm receiving through all the different apps, I'm feeling much more stressed. So that's why I'm advising everyone to take an active, to be proactive about shutting down that phone and not to pay attention to the messages. Limit your screen time. This is a great time to connect to people who you haven't been spoken for a while. Schedule the video hangouts with them. Talk to people. Connect with them. Keep the video communication, because we are all isolated or distanced now, but it is a time to connect with people you know. Stay active. Please take the walks on nature if you get a moment for at least 20-30 minutes a day. Exercise either at home, do the high intensity interval training that you can find a lot of those workouts online, but stay active. If you go outside, practice your social distancing. Meditate because it will control your stress. And watch funny movies and laugh. That's also really, really important. So if you want to take supplements, and many of us do take supplements, here's a basic support. You want to have your vitamin D, vitamin A, vitamin C available, zinc, and probiotics. I would stay with those few options as the beginning of preventative and keeping your immune system in a great state of health. You probably want to look for advanced support, like if you're having a difficulty of sleeping, there's different products that we can recommend, and you probably know them already. If you feel overly stressed, your adaptogenic herbs like ashwagandha and rhodiola and ginseng would be a great option. Some advanced support that we can suggest is to support your natural killer cells and some antiviral protocols, but I think those will be much more applicable later on if we are infected. Another thing that I strongly recommend lately, because there's more and more evidence, is N-acetylcysteine, NAC, famous NAC, to take that 1 or 2 tablets per day. Anything you want to add, Marc, about the adaptogenic herbs, because that's your favorite?
Sure, yeah. So adaptogenic herbs, those are the herbs that include things like eleuthero, rhodiola, ashwagandha, licorice. All of these can really, I call them stress vaccines. And they can really support to just keep us adaptable to the stressful environment that we may be faced or currently under. So those can actually be used as preventative.
Do you need to take them on the regular basis, or you can take them as needed?
You can take them as needed. I like to take them on a regular basis. It's part of my personal protocol. So I use eleuthero, rhodiola, schizandra, withania, ashwagandha, all of these herbs usually on a daily basis.
You take them all together?
I do. I take them throughout the day sometimes.
I personally like rhodiola, and I try to take it on a daily basis. But ashwagandha, especially as a liquid extract, I keep it as needed basis. So if I feel I'm overly stressed, then I'll just take a teaspoon of ashwagandha, and that's usually enough for me. So what we want to talk about is, what if you get infected? And we all going to get infected eventually. And I'm going to get Marc to talk about it.
Yeah, so it's estimated that perhaps anywhere from 40 to 60% of the country may become infected at this point. And so for most of us, what does that mean? That means that we'll probably be either asymptomatic or just get through it with some sort of mild suffering. But again, there will be severe cases and then some critical cases, and we see those now stacked up in the hospitals, in the ICU and emergency rooms.
Right, but 80% of us with a good immune system, even if we are elderly, even if we have some other disease of some other comorbidities, other chronic medical illnesses, will probably have a very mild duration of this illness, more like flu symptoms. So, go ahead, Marc.
Right. So how do you recognize if you may become infected? Well, I think we all recognize some of the regular symptoms of a flu, and so that may be similar. So first of all, we're looking at a temperature, and that might be over 100 Fahrenheit. And then we're looking at cough as a signal or sign. What body aches are part of what someone might feel. But what a lot of people don't realize, and studies coming out of China going back 2-3 months ago indicate that people may also get GI distress, and that includes nausea and diarrhea, stomach upset, and so forth. So those are key symptoms to also look out for.
And it's very important, but I think that diarrhea or GI symptoms will not come alone. They should come with something else. They would come with a fever, or they will come with a cough or body aches. So don't, some of my patients were contacting me, oh, I have a worsening of their GI symptoms. I probably have COVID-19. Do you have fever? No. Do you have cough? No. You have a body aches? No. Well, it's less likely that it's a COVID-19, okay? But majority of the people who have fever, cough, myalgia, headache, and so stuff like that.
So the infectious rate is very important for all of us to recognize and understand. And basically, there's a formula. It's called R0, and it's basically the spreadability factor. And so with COVID-19, we have to all understand that the spreadability factor is fairly high, and it's considered to be 2.5 to 3. And what that means is that each one of us can possibly spread COVID-19 virus to 3 other people, and then each one of those people to 3 people. And so after a short period of time, as we're seeing now here at the epicenter in New York City, we have an exponential curve that just shoots and takes off. So we want to remain 3 to 6 feet apart and quarantine ourselves in order to keep that bubble down.
And we know, of course, that people with pre-existing condition like cardiovascular disease, diabetes, chronic respiratory disease, high blood pressure, huge risk factor, right? So people who are healthy and don't have any chronic medical illnesses, probably at less risk. People with those diseases are at higher risk. And that's what we really see in New York as well.
Okay, so I just want to take a moment, and we're not going to get so technical at all, but I just want to give you a brief understanding so that everyone has a little bit of comprehension about how the virus works. So it's a respiratory virus. It gets in through the nose, through the eyes, through the mouth, and its target point basically is the lung tissue. So once it goes into the lung, deep into the tissue, it goes into what are called alveoli. And the cells that line the alveoli, those are little sacs or pockets where basically gas exchange occurs. And so what happens is, you can see on the top left-hand side where A is labeled, that's where the virus COVID-19 actually attaches itself. It has to use a receptor site, and it uses the ACE2 receptor in this case to attach itself to a cell. And so that's a first point where we can look to inhibit the possible infection. And then once it gets inside the cell, the COVID-19 virus releases its positive single-stranded RNA, which then gets replicated inside the cell. Again, without being so technical, it goes through ribosomes and it replicates itself just like a copy machine. And it makes a whole bunch of different RNAs. And then lots of enzymes called polymerases all come together, and the assembly begins. And basically, the cell spits out many, many, many new copies of COVID-19 virus to go on and infect the rest of the body. And so if we take this information into account, and we can learn with either supplements or pharmaceuticals to block the receptor site, to block the points of reception or assembly phases, then we can lower or diminish the causative effect of COVID-19 disease.
So basically the virus is hijacking your cell and uses it as a machinery for replication.
Exactly, yeah.
Through the, so
it's
that's where we
parasitic in
need
that way.
to, yeah. So that's where we need to direct our intervention. Yeah. If anybody who just joined us recently can please mute yourself. It's a button on the lower left corner where you see the microphone. You can just mute yourself because we hear the sirens and other things. So please mute yourself as you're joining in. So what do we need to know if we get sick? So at this point, if you experience any fever, cough, body aches, headaches, or just feel crappy, excuse my French, you probably having COVID. No need to, don't panic, no need to stress. Majority of the time, you will be going through this process and recovering from it. Definitely notify your practitioner or get in touch with your primary care doctor or me to notify that this is what's happening so we can guide you through the process. So you can be one of those uneventful events, uneventful cases, and you don't need to progress with your disease. But the rule number one, if you're sick, you're staying home. You're staying home if you have fever. You're staying home if you have cough. You're staying home if you have body aches. You're staying home even if you have a COVID-19 confirmed by testing, or if someone in your household got sick with COVID-19 and you know that you're exposed to it. You are staying home, and we help you to go through this illness at home. That's rule number one. Notify your physician, as I said. Now, when do you go to the hospital? You go to the hospital only and only if you become short of breath. Only if you start developing symptoms of respiratory distress, you need to go to the hospital. This is very crucial to understand, that you do not need to go for testing, because New York City testing is extremely limited, and you will probably not go far, and you'll just go to the hospital for no reason. They do not test people unless people are hospitalized. And again, we hospitalize now only cases that have respiratory distress. You will be returned home and your trip will be wasted. And save your energy, save your strength to recover. Stay home and do supportive therapy. The reason why we don't test is because having knowledge that you have a COVID-19 is not going to change our tactic and our management. Of course, it will be easier for us to know if you are COVID-19 positive, because now then you know if you need to be completely isolated from your house, in your household, or from your other, from the household mostly, right? But please do not waste your energy that you can use for healing by going to the hospital and looking for places to be tested. Stay home and recover. At this point, we all consider to be positive if we have symptoms. If you're really sick, the first thing you need to do, try to isolate yourself in the separate room, and ideally in the separate bathroom. That's the best thing you can do to protect your own family members from their exposing yourself. Very importantly, if you have elderly in your household, it's important to isolate them from you. Either people who are older than 80 or have comorbidities, cardiovascular disease, high blood pressure, diabetes. If somebody is immunocompromised who just had a chemotherapy, these people need to be out of the sight as much as possible. So avoid interaction with those. If you're sick and you need to come out to the common area where the other family members are eating and playing and doing other things, it's very important for you to follow the several rules. Before you come out from your isolation room, wash your hands, use mask, separate your dishes and utensils from everybody else, run the dishwasher daily to clean the dishes so nobody get infected. You would have to minimize the contact with your family. That's unfortunate. If you have fever, it means that you're contagious. You stop being contagious only after fever is subsided and you don't have fever for 2-3 days, at least 24 hours. Then you can start coming out, still wearing mask, still practicing all the rules that we said. Remember, disease is transmitted through hands, face, and contact, prolonged contact. So repeat it as mantra. Wash hands, don't touch your face, avoid the contact. If you do that, you spared from containing the virus. What else you can do if you're sick? Remember the Jewish penicillin, of course. What are you gonna eat? You want warm soups, you want the bone broth or vegetable broth, eat those as much as you can. You can order those from to be delivered to you. You just warm them up, maybe put a couple of pieces of vegetables, boil it, here's your soup, right? If you're not hungry, it's okay not to eat, because one of the symptoms of the virus, as we know now, is loss of smell and loss of appetite. It's okay, but you have to hydrate. It's extremely, extremely important that you continue to hydrate yourself. Remember the rule of half of your weight in ounces. And another good criteria, if you're hydrating enough, is that you have your urination, you pee every 4 to 6 hours. If you stop peeing, if you pee less frequently, you are dehydrated. You need to drink more of the water. I like this recipe of drinking the fresh ginger tea with lemon juice. You basically just boil chopped ginger and you pour it in the cup. In that 1 cup, you squeeze the juice of the entire lemon. So this is something you need to stock up with, lemons. And then you add 1 teaspoon of the turmeric, and you can add a little bit of the honey because it's pretty bitter. And you drink that as a medicine 3 times a day. It does many things to stop the virus from replicating, to stop virus from entering, and helping your body to deal with the consequences of that that inflammation that virus cause in the body. And if you still want to take some supplements, of course, it's really important. Again, your basics, your zincs, your vitamin D3, your vitamin A, your probiotic, continue to do that. But now we want to actually boost up additional supplements. You definitely must take N-acetylcysteine at this point. Sicker you get, more glutathione you want to take. You want to take up to 5 times a day a dose of 400 to 500 milligrams. What does it do? It lowers that storm of the inflammatory molecules that are created as your immune system is fighting the virus. It's going to create a lot of cytokines. Those are the messenger molecules that call the army of their immune cells to kill the virus. That creates a lot of debris, a lot of gunk that make you feel achy and painful and feeling like the truck hit you. That's what glutathione is going to do for you. It's going to clean up all that battlefield from debris. I would like to take some andrographis right away, echinacea at some quantity, increase your vitamin C to the bowel tolerance. For the cough symptoms, which becomes really bothersome, I would recommend to stock up with the Chestal and Bronchofact. If you have a fever and you cannot tolerate it, I'm a big proponent of keeping the fever going, and only if it becomes extremely uncomfortable, start taking something. But please, please, please avoid any non-steroidal anti-inflammatory medications. We now know that those medications associated with a worse outcome. If you absolutely need to take something for the fever, take Tylenol, acetaminophen, which is available over the counter. And sleep, sleep, sleep as much as you can. Control your stress. And make sure you also, again, I just want to reemphasize, wash your hands, don't touch your face, don't spread the virus, stay isolated, and avoid the contact with people. So again, I want to reiterate, when do we go to the hospital? Hopefully all of you will have a contact with your practitioner if you get sick, so practitioner can guide you more precisely on what to do, but only if you're having shortness of breath, at rest, or in exertion, you want to go to the hospital. Otherwise, we are supporting our body, we keep the hands sanitized, we keep hands away from the face, and we keep distance with those who are not sick, okay? And many of you probably know this graph. Marc, you want to comment on the graph of the flattening the curve? Because that became a mantra of New York City and the entire America and probably the whole world. Let's flatten the curve.
Well, that's basically the whole reason why we are all staying in our homes right now, is to flatten that curve. And what that means basically is to flatten the curve is to slow down the rate of infection so that we keep the influx of individuals going into the hospital and ICU down at a lower level so that they can manage and handle things properly.
Yes, so the critical cases that are now flooding the New York City hospitals are extremely high. So the hospital is basically closed for any other elective procedures or elective care. So all the forces are directed to handle patients with COVID and mostly critical cases. Remember, there's a minority of the critical cases need intubations, ventilation, and staying in ICU. And majority of the people recover from it. So don't think that if you are in the ICU, it's a death sentence. No, no, no. Majority of the people will go through the critical care and will recover successfully from it.
So right now in New York
So
City,
no need to be stressed about it. What you need to focus is on prevention, washing your hands, don't touch your face, stay distant from people who are sick, and from people who are not in your household. So practice social distancing. And if you get sick, just continue to support yourself at home.
right? So right now in New York City, it's estimated that we're probably shy of 2 to 3 weeks from the apex of this infliction and infection. And so that's why we want to keep flattening the curve. And that's why it's so difficult, of course, all of us staying at home. The economics are difficult for all of us. And so we want to keep doing this to keep that curve down as low as possible.
And now we're going to just take some question and answers. If you can, I know we got a lot of questions in the chat box. So we're going to just go from one question to another. Okay, question from Lauren. There should be a way for the host to mute everyone, I believe. We did that. Sorry about that, guys. I know that new cases were coming in, and I hope everybody is now on track with that. Jacqueline, question. Can you do that for those who do not understand how? Okay, mute, mute, mute. Okay. So here's a question from Lauren. There are people under 17 who have died. I believe just 1 or 2 cases. My data that I know, and this is the data from New York hospitals at this point, that from 0 to 14, nobody is getting sick. I think there was 1 or 2 cases and of a little bit older adults. I don't think there was a mortality in that group category, but was just a severe disease that was handled in their ICU, and I think they recovered. Obviously, the following applies with comorbidities. If someone from their some younger population is going through the chemotherapy or through immunosuppressive treatments, of course they're going to be at higher risk. But I haven't. Do you know anything about the younger cases being fatal?
Well, again, the percentages are very, very low. That doesn't mean that young people can't die. There have been across the spectrum some young people who have died. But I think theoretically, because we don't know, it's too early at this point, that probably young people aren't getting infected at high rates because they have strong immune systems, low toxicity levels, that sort of thing. So
okay, and the similar question from Jacqueline, that I've heard that the young adults in New York City have been getting very sick, and they have definitely been deaths in California as well. Yes, there will be. So this disease doesn't spare anyone from 20 to 105, right? From 14 to 105, people are at risk. Remember that majority of those will be easy breezy cases. They will go either asymptomatic or minimally symptomatic. The key is to stay home and not spread it around. And that's why we're all distancing. So yes, young people will get the disease. The duration is definitely going to be much lighter than someone who is older. And those cases who that get much more severely sick will be handled but in ICU, but we're trying to slow down how fast those severe cases start coming to ICU. That's why we're all being on distancing.
Okay, so the next question says washing the nose. Won't the virus go inside the nose? I don't have bleach. What else may I use? Can I use vinegar?
For washing their
Nose,
nose.
So
No.
wash your
This
nose.
is the washing nose. Won't virus go inside of the nose? No. When you wash the nose, you basically just washing it out. If you
Use a little soap.
you use a little soap, so you're just washing the port of entry of the virus. It's an old trick. If you flush your nose and you swallow the mucus from the nasal passages into your gut, and you have an adequate amount of stomach acid, it will probably kill it. Remember, what we're trying to prevent by washing the nose is that the virus attaching to the mucus or attaching to the cell and hijacking your cell and use it as a machinery to replication. Virus can stay longer in the mucus that we accumulate in the nose. That's why it's so important, in my opinion, to keep flushing the nose with their normal saline and then possibly use silver, homeopathic silver like Argentum 23 to wash it after that, because it also has antiviral effect. So we missed, I think, one more question. The number of hours is cut off on my screen on the left. Sorry, don't understand the question.
Okay. So the next question is about cooking. So if I cook vegetables, does that kill the virus?
Absolutely. In my opinion, it does. Yeah. And then just cleaning them with that mixture that I gave you also will kill the virus. So they can stay in your refrigerator without any problems. Remember, virus will not survive for more than 24 hours on the surface of your fruit and vegetables if they contaminate it. So even if you just wipe them off, put them in the refrigerator, in 24 hours, they're safe. Your job is to wash your hands. Do not touch your face.
Yeah, so you should know that this virus it's actually a very sensitive virus, and it is highly susceptible to heat.
Yeah.
Okay, next question is about, should I wash the sheets on a daily basis? Do people need to do that?
I don't think so. I don't think you need to. It depends on also, are you sick or you're not sick? Do you have any other people in your household or not, right? Remember, your home is your castle. There's no need to worry about if you're not spreading it out. So you don't really, in my opinion, you don't have to do that.
Right. So it all goes back to building the shield. That's what we're talking about. Having a strong immune system, because remember, we are around viruses and bacteria all day long. It's part of our environment. So this is not really any different than that. Okay, so next question is, if I don't have bleach, if no bleach, can we clean groceries with sanitary wipes?
You can. I believe that just washing the groceries, if you can, with the water, and if you have no bleach, it's not a problem. Again, you can quarantine certain things for 24 hours, and that's enough to assure that virus is not there. Great.
Someone asked now about what are NK cells, natural killer cells.
So natural killer cells, they're our soldiers and it's immune cells that attack cells that attack microbes in the body. So they basically get a message from other immune cells, and they start attacking the cells that are, and killing the cells that are infected by the virus. So activating those natural killer cells so they're moving faster and they're much more alert and they're not sluggish, and the number of them is multiplied, is extremely important for our innate immune system, the system that is basically spraying the bleach on pathogens, is very, very important.
Oh, okay.
So there's several natural killer cell stimulants that we know, right?
Absolutely.
Which one is your favorite?
Natural killer cells, there's some of the adaptogens can provide and boost, stimulate natural
Some of the
killer cells.
mushrooms will increase the
Mushrooms as
natural
well.
killer cells. Yeah, like turkey tail.
Turkey tail, maitake.
Yeah. Remember that we need to activate those systems if we are sick. You don't need to do it now. For basic support, just use zinc, vitamin D, vitamin A in the doses prescribed. Probiotics, extremely important for prevention, and vitamin C. So I wouldn't even do more than that.
So next, someone says to everyone that someone has GI symptoms and a headache. And I want you to comment on that, but let me just say that the initial phases of contacting an infection with COVID-19 usually are about day to 1 to 3 or up to 4, could be very mild symptoms or even asymptomatic, no symptoms at all. And then usually day after 3 or 4, sometimes a lot of patients start to experience more severe type symptoms. So what would you say to someone who already has a headache and some GI distress?
So if it's something out of the ordinary that people might have, like we all know that, oh, this is my typical headache, oh, this is my typical GI symptoms, probably...
do they need to go to the hospital?
We do not go to the hospital, right? We do not go to the hospital unless you have shortness of breath. That's the only time you go to the hospital. Otherwise, be in contact with your physician. Now, going back, and sorry for that noise, we have a construction outside. What you need to remember that at this point, if you're sick with anything, anything abnormal, you have to treat yourself like if you have a COVID-19. Isolate yourself for 2-3 days. See how you feel. If you're progressing, you continue to isolate yourself. If you're feeling better, you can come out and expose your household members to whatever you have, right? So any illness at this point should be considered as you have it. So take necessary precautions. If in 2-3 days you're doing better, most likely it wasn't COVID, but it's still good to take precautions. The duration of the disease is that the peak, the crescendo of the disease is developed from day 5 to day 7. Okay, so you need to kind of live until the day 5, 7, as if you have it. And if on day 5 you're definitely you're improving, oh well, it's not that, right? But if you continue to escalate in your symptoms, then you took all necessary precautions to expose people who you communicated within those 5 days from exposing them and getting them sick, spreading the virus. The problems happen when people are being nonchalant and cavalier, having some mild illness, and continue to live their lives and not taking precautions. That's when we're spreading it, because the spread happens when you're symptomatic, but also 2-3 days before we get symptomatic.
So there's a lot of questions here, Dr. Klimenko, and I'm going to read one from Eric. He wants to know, what is the mechanism behind nasal spray? How does that work, and why is that beneficial?
Are we talking about, so I mentioned 2 nasal sprays. One is a normal saline nasal spray that just mechanically removes the mucus that, in my opinion, is a harboring environment for many bacteria and viruses. So I want to flush it out. I don't want to welcome any viruses or microbes that can sit there. And the second spray is their homeopathic spray of the silver, Argental 23, for those of you who know what it is. You probably know how it works. So it's basically, silver is an antimicrobial. So it basically kills viruses, fungus, bacteria, and all living organisms. So by spraying it into the nose vigorously, periodically, especially after potential exposure when you come out, basically, in my opinion, and it's my hypothesis, and it's what I do for myself, basically it will kill potential exposure to the virus. We use this spray for the treatment of a variety of infectious illnesses in their nasal pharyngeal area. So people with chronic sinusitis, with their even acute sinusitis, we use it with their good success rate. That's why hypothetically I'm using it and recommending to everyone to have it handy. I also like to use it for gargling my throat. on a daily basis, and more frequently, like at least once a day, taking a teaspoon of homeopathic silver, hold it under the tongue, gargle, and swallow. If I do have any symptoms of sore throat, I definitely will use it even more frequently. And in my experience, it works really well.
Next question is Janie wants to know if you can contact COVID-19 virus from someone who's totally asymptomatic, they have no symptoms, or can it only be contacted from someone who is already highly infected and shows symptoms?
Well, that is the problem with this virus. People who have a mild disease spread it. People who do not have any symptoms and maybe they will develop symptoms in a couple of days, they're spreading it. That's why we are on social distancing, because every one of us considered to be a carrier of the illness. And either we don't know about it and we're shedding it, or we are getting sick and we don't know yet whether we're shedding it, or we think it is not a COVID-19 and we're spreading it. So everyone is potentially a carrier. Now, you are empowered now by the information because you know how you can contain it. That's the only way you can contain it. If it gets on your hands and then you touch your face and you touch your nose, your eyes, your mouth, and you're infecting yourself. So washing the hands, keep your hands away from the face. I know it's kind of like redundant what I'm saying, but it's an empowering information because you know how you can get it. So if you take those precautions, even if you were in communication with someone who is sick and you take those precautions, you're not going to get sick.
So Jacqueline wants to know if you know of any place where you can get facial masks. We know that they're sold out all over.
They are sold out, but here's a good point. It's a good question. Thank you very much for bringing it up. At this point, when you go outside and you just put bandana on your face, it's still good. You know why? Because you need it to train you not to touch your face when you're outside. Of course, you're going to also protect yourself from exposure of someone sneezing at you, or if it's aerosol. But even any shield, any any fabric over your face will help you to prevent spreading the virus and contain and protect you from getting infected. So yeah, use bandana, use the scarf, use a beautiful scarf on your face if you need to go outside, if you don't have a facial mask.
Any cloth.
Any cloth, right? Yeah.
And her follow-up question is, what do you do if you don't have a dishwasher? Any suggestions? Maybe bleach or just...
Well, I think just the hot water and the soap, the regular, remember the virus is broken down by the soap, as Marc presented, that surfactant, the ingredients in the soap will break down the virus. If you don't have a dishwasher, it's okay. Just wash it properly. And if someone is sick at home, separate their dishes, their cup, their bowl, soup bowl, their utensils. That needs to be separated, okay? And not touch other people's dishes.
So Susan asked, what did you say that you should take 5 times a day at 400 mg? I think it was vitamin C, right?
No, it was, if you're sick and you're getting all those body aches, pains, and symptoms of intoxication, you need to take glutathione. Glutathione, okay? And I'm going to type it in your glutathione.
E at the end.
E?
Yeah.
And that only, you take it only if you're sick. You do not need to waste this expensive and very valuable product if you don't have any symptoms. But if you're getting sick and you get that, what we call cytokine storm symptoms of being very, very achy and just being sick, body aches, headaches, that's when you need to take their glutathione. Sicker you are, more glutathione you need to take. So anywhere from 1 time a day to 5 times a day, sicker you are, more glutathione you want to take.
Next question is, do you have any comments specifically about the N95 mask versus regular surgical mask or cloth?
Yes. it's a very good question. So N95, none of us need N95. None of us need it. You need it only if you're handling sick people for prolonged period of time. So the data from Cornell University, from people who are dealing with critically ill people, people who are suctioning the mucus from their lungs, these people need N95. Even regular nurses in the hospital that come into the room of the sick person with the COVID-19 to hang the bags of the IV or check their vital signs, check their temperature, they do not use N95. You need it only if you're dealing with their sick people and you're dealing with their prolonged contact with their people who are carriers of the N95. So please, if you have it, if you have a supply of N95, donate it to your local hospital, because those people are really suffering from doctors being infected due to the lack of supply. But we do not. If you have it, great, but you probably don't need it. As I said, if you go outside, you can just put the cloth or bandana or scarf on your face. And it's mostly to train you not to touch your face with the dirty hands.
Do you have any comments about oregano? So let me just say, oregano is great. Oregano or oregano oil is antibacterial. It's antiviral to some extent. So it can be used. I wouldn't say that it's a major herb or spice that's going to kill the COVID-19.
It's probably not the major one. No. I don't think it's really necessary right now to take it, unless you take it for other reasons.
But if you want to sprinkle it on your food, it can't do any harm, right?
Take oregano, yeah.
How much colloidal silver should you use?
I'm not a big fan of colloidal silver in general. I don't think it's that safe. I think in small quantities it's probably okay, but for daily use, I would not probably use it. So I would stay with their homeopathic 23 parts per million silver. Many different companies are doing it. If you Google homeopathic 23 ppm part per million, you'll get a whole bunch of different brands that do it. And that's what I would stick for now.
So Janie asked, do you need to wear a mask if you're 6 feet apart from each other? Let's say you're walking in the park or something like that. Do you really need to wear a mask?
You need it only to train yourself not to touch your face.
Okay. Any extra precautions for moms due to give birth soon?
I'm at 38 and a half weeks now and giving birth in the hospital, also my recommendation after delivery. So as I understand, pregnant women are at similar risk as the general population, but none of the pregnant women have been critically ill as of now in New York City in Cornell Hospital. So we don't know if it's like just nature protects you, which we know that usually immune system is shifted, right? So you don't respond to vigorously to the viruses and bacterial infections during the pregnancy, but you are basically at the same risk. You do not need to take any extra precautions. You should continue to live the life as all of us, and be assured in the hospital there are multiple measures taken to separate pregnant women from sick population. So I think you, especially now, hospitals taking tremendous actions to protect pregnant women from exposure.
What do you think about a neti pot with saline solution as far as nasal rinse?
Get it down, get that snort out of your nose any way you can. Either you're doing a neti pot, or you do Nasopure bottle, or you do Arm & Hammer nasal spray that you can just order on Amazon. That's what I use usually, because it's easy and it's fast. You just spray it in your nose. And so any way you can, just get it down.
Great. So a really good question, I think this is really important. Someone asked, if they are infected, can they get reinfected?
So it's too early to say. That the preliminary data say that once you're infected, your body mounts their immune response. So you now have protection against the virus. If you're being reinfected, you usually have asymptomatic illness. So you can get another bout of illness, but it will be less dramatic and less severe than before. So basically, we believe that this virus oblige the rules of a regular infection and other viruses like flu. So once you have it, you do not respond with the illness for the second exposure unless the virus mutates. And that's what, if the virus mutates and next year we're going to get another version of the same COVID-19, but it's going to be slightly changed, then your immune system will respond to that new one, but probably with the less severe disease. Remember, majority of us, if we're younger, if we're under 70, we're not going to have a severe disease. But even people over 70, majority of them will be fine if you follow the rules. But remember, you know how to prevent this disease. Hands, don't touch your face, distance yourself from everyone other than your household.
Next question is, Susan asked, what should I do when I receive cartons, like cardboard materials, to her home?
So as you presented, the virus lives on the carton box for 24 hours.
Right.
So I personally, if it's not essential purchases, I just leave the box outside of my door. I quarantine it for 24 hours, and then I open it. If you absolutely need to open it now, use the same rule as I told you. Open it on their towel, remove everything, wash your hands, don't touch your face. Discard the carton box as soon as possible from your apartment or from your house, and put their towel into the laundry.
The boxes are being delivered to an autoimmune person, to my son. What can he do when he receives them? Because they're going from his lobby into his apartment and he's spraying vinegar. Is that sufficient?
I believe, well, can he do their recipe that I just gave?
He doesn't
with the
have
bleach?
He doesn't have bleach, and he responds to bleach badly. He doesn't, use
Okay, so then it's better probably to quarantine the boxes and then open them later. And that's the safest way.
Okay. I don't know, because we have to pick them up and give them to him. There's no place to quarantine him. They're
right outside of his
box.
door. He can quarantine it right outside of his door of his apartment for 24 hours.
His apartment. Okay.
Can you mute yourself, please?
Right,
so we can. Thank you.
Okay, next question comes to us from a gentleman who works in a hospital in the concierge area. And basically he's asking, is he at high risk? Should he quit his job?
Well, it depends on many different factors. It depends on your immune system status. And again, remember, you can get this disease by touching the virus and touching your face. If you can use the mask not to touch your face, you're safe. It's a personal matter if you want to quit your job at this point.
So the next question is from a wife who's saying that her husband is currently coughing, and she wants to know if she's at risk. And he's been coughing now for, it looks like, almost 2 weeks. Does she need to insulate or isolate herself?
So if your husband is coughing, most likely he has a COVID. That's how we need to interpret it. So he should not be working if possible, because he's spreading it to other people, unfortunately. And if you were already in close contact with him, you probably have been exposed. So you need to isolate yourself from anyone outside of your family. Again, if you develop symptoms, which is very likely, you can manage yourself at home conservatively with supportive care that we outlined. Only if you get short of breath, you go to a hospital. Please do not seek any testing at this point, because we do not test people unless they go to the hospital for shortness of breath.
Are people who are HIV positive more vulnerable? Is the next question.
if the disease is advanced, of course. If disease and the initial, if their immune system is in their good state, then their risk is the same as everyone else, in my opinion, in what we understand now. All right. So we actually way over our time. We're gonna take all the questions and answer them through their emails. Thank you very much for everyone for participation. We're really happy that you all join us. Please keep an eye on your email boxes. We probably will be announcing another webinar maybe in a week or so to answer more questions. Meanwhile, please keep in mind that we are working remotely. We're consulting patients through the telemedicine. If you need an appointment, just call our office and schedule a session with us. Or just email me through the portal if you have any questions, if you're our patient. Thank you very much, everyone.
Stay safe. Stay safe. Well. Thank you.
Yeah, and stay,
Bye.
remember, wash your hands.
Thank you.
Wash your
Thank you.
Stay
Thank you
safe.
for joining.
Thank you.
Thank you, Elena.
Thank you. We love you.
Thank you, Jane.